Hello, my name is Abigail Longsdorf, and the following video will detail the case of a young man who presented to the ER and subsequently underwent a variety of clinical tests in order to diagnose his condition. Broadly, these tests were a glucose determination, kinetics, and a urinalysis. So, patient history. The patient is a 17-year-old male weighing 142 pounds and standing 5 feet 10 inches tall. And he arrived at the emergency department with complaints of whole body muscle soreness and nausea following 2 4-hour-long workout sessions. And his mother also noted that following these workout sessions, which were for his high school football team, he was a bit confused when he came home. All of his vitals were normal except for his blood pressure, which measured a little bit high at 145/92. And his urine was also a reddish brown color, which was noted during the urinalysis. So based off of these symptoms and the history, I hypothesized that the patient was presenting with rhabdomyolysis, or rhabdo, which is a condition characterized by the breakdown of skeletal muscle due to muscle injury or exertion. So the first test that was performed was a blood glucose test, and in blood glucose test, the meters contained the enzymes glucose oxidase and glucose dehydrogenase, and these enzymes work together with hydrogen peroxide and mediators to facilitate the transfer of electrons and reveal the amount of glucose that is within the blood. So a normal value for blood glucose ranges between 70 to 100 milligrams per deciliter, and the patient was presenting with a level of 100, so that indicates that his glucose was within a normal range. And then a Kinetics reagent test was also performed, which during this test, a solution of copper 2 sulfate, sodium carbonate, and sodium citrate was mixed with the sample, which in this case was urine, and the Kinetics reagent, and all of this was heated in a bath of boiling water. And in doing so, a chemical reaction should occur, and the color of the solution should change if there is a presence of excess sugar within the urine. However, in this case, the solution remained blue. There was no color change, which indicates, again, that his glucose was normal. And then lastly, a urine sample was applied to a reagent strip, and during this process, a reaction similar to the one in the Kinetics reagent test should occur, which causes glucose to oxidize. However, again, the test strip did not change color, which indicates that the glucose levels were normal. These tests were ordered in order to rule out diabetes, hypoglycemia, but the test gave no indication that he was experiencing any of these conditions. Furthermore, the patient underwent enzyme kinetics, and the enzymes that were being tested in this case were CK and LD. CK is responsible for converting ADP into ATP, and ATP basically serves as a fuel source for every action that our body needs to carry out, any action that requires energy. So as you can imagine, something like strenuous workout requires a lot of ATP. So the patient presented with elevated levels of CK enzyme absorbance, which indicates that his muscles had been extremely overworked or that there was extensive damage to the muscles. On the other hand, LD enzymes work to clean up, so to speak, the byproducts of anaerobic metabolism, and that byproduct is the molecule lactic acid. So they accomplish this by converting lactic acid into pyruvate, which is used to basically produce more energy for use during any activity. And in this patient, the LD enzyme absorbance levels were abnormally high, very high, which indicated that the LD enzyme was working very hard to eliminate the byproducts of the intense workout that the patient had been undergoing. And this is in line with his complaint of whole body muscle soreness. Additionally, a urinalysis was conducted, and as a part of this urinalysis, the patient underwent a protein test. So for this protein test, 8 milliliters of urine were boiled in order to denature the proteins that are present within the urine. This disrupts their bond and causes them to lose their 3-dimensional structure in aggregate, and subsequently that causes a precipitate to form, which reveals how much protein is present in the urine. A weak acid, acetic acid, is also added to the urine, and it is then reboiled. And this lowers the pH to prevent the properties of the protein from being changed. However, after this test was conducted, there was no precipitate present, meaning that his kidneys were functioning efficiently and there was no protein present within the urine. More parts of the urinalysis included tests to determine the specific gravity and the pH of the patient's urine. So specific gravity measures the ability of the kidneys to dilute or concentrate urine depending on what the body needs in that moment. So for this test, reagent strips induce ion exchange, which change color to indicate the amount of ions that are present within the urine. And then in the pH test, the pads on the reagent test strip contain components which react with hydrogen ions in the urine. And the pads on the test strip then change color, which indicate whether the urine is acidic, neutral, or alkaline. The healthy ranges for specific gravity and pH are 1.005 to 1.030 and 5 to 6 respectively. And the patient measured 1.015 for specific gravity and 6 for pH, which indicates that this test came back with normal ranges. A ketone and bilirubin levels were also assessed using reagent strips. And the ketones present in urine are byproducts of lipid metabolism. And if ketones are present, that could indicate untreated diabetes or starvation. Whereas bilirubin is a byproduct of hemoglobin breakdown. And if there is a presence of bilirubin, this can indicate problems with the patient's liver or bile duct. And again, for this test, the strips contain compounds which interact with the ketones and bilirubin and change color in order to reveal their presence in the urine. However, in this test, the strips again did not change color, which indicates that the liver, the bile duct, all of that, everything is functioning properly. Lastly, the Elbrick test was conducted in order to determine if the byproduct of bilirubin metabolism, which is urobilinogen, was present in the patient's urine. And its presence can indicate if a person is experiencing a liver or hemolytic problem. The reagent in the Elbrick test is dimethylaminobenzylaldehyde, or DMAB. And if this byproduct is present in the urine, it reacts with the DMAB, changing the urine's color. But again, there was no color change in this case, which means that the urine was normal. So in evaluating the results, the glucose tests were normal. The enzyme kinetic test showed that the CK and LD enzyme absorbance levels were very high and that these enzymes were hyperactive, which was likely the result of his extensive workouts. And then again, the results of the urinalysis were normal. However, the dark reddish brown color of his urine was alarming. So my final diagnosis of the patient is rhabdomyolysis. Dementia was one of the options listed. However, the patient does not fit the profile for this diagnosis because he is simply too young. Liver disease. It is possible for people who suffer from liver disease to experience muscle soreness and reddish or brown urine. However, if he was suffering from liver disease, bilirubin and protein would have been present in his urine, and they were not. Hyperglycemia and hypoglycemia were not evident due to the fact that his glucose tests were normal. Influenza, while headache could be a symptom of influenza or like muscle soreness from a fever, his vital signs were normal. He did not have a fever. He also did not have any of the other classic cold or flu symptoms like headache, runny nose, cough, chills. And influenza would not explain the color of his urine or an increase in the CK and LNG enzymes. Kidney disease, I do not believe that the patient was suffering from kidney disease because his urinalysis was normal, and also this does not explain the elevation in his CK and LD enzymes. Ear infection, the patient did not complain of any ear pain, and ear infections don't typically cause muscle soreness or reddish or brown urine. Diabetes, the patient's glucose levels were normal. UTI, this is usually detectable through urinalysis, and this was not indicated for this patient. And dehydration. This was the one that I thought, other than rhabdo, could have been most likely, because in dehydration, people can be confused. They can experience muscle soreness, and they can have dark colored urine, and they can experience nausea. But this, again, does not explain the elevated CK and LD enzymes, so that is not consistent with dehydration. Finally, for my treatment plan, I would begin treating the patient for rhabdo, and in doing so, I would immediately admit him to the hospital so as to prevent complications such as kidney damage or kidney failure, electrolyte abnormalities, metabolic acidosis, and compartment syndrome. I feel that the top priority should be to manage the patient's pain, and also order a muscle biopsy test in order to determine if the patient is genetically predisposed to developing rhabdo, and also just to get a better idea of what's going on with his muscles. It is also essential that the patient is aggressively hydrated in order to flush these excess enzymes from his system. So I would put him on continuous IV fluids and electrolytes. And then I would also advise the patient to rest and urge him to take it easy during future workouts. And if all of these efforts were unsuccessful and the patient did sustain damage to his kidneys due to the excess toxins within his muscles, he would have to go on dialysis. Thank you.